And so we continue on here. We have the extensor carpi radialis longus, extensor carpi radialis brevis, and brachioradialis, along with the extensor digitorum. You can also see the adductor pollicis longus and extensor pollicis longus muscle, as well as extensor digitorum indicis and extensor digitorum minimi tendons in the clenched fist of the hand. Moving down into the thigh, we get the iliotibial band, and deep to the iliotibial band, we have vastus lateralis. Moving on to the crural region, we get tibialis anterior and extensor digitorum longus. We will also see our peroneal muscles, sometimes referred to as the fibularal muscles. To the anterior and medial thigh region, we will see sartorius and vastus medialis. On the anterior thigh, we'll see rectus femoris. Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius will form the quadriceps femoris. In our adductor group, we have adductor brevis and pectineus. We will also see adductor longus, adductor magnus, and gracilis. We have 2/3 of triceps surae here. We have the gastrocnemius and the soleus muscle. Moving on to the posterior hip, we will see gracilis as well as adductor longus and adductor magnus on the medial side of the posterior hip. The principal muscle that we'll see with the posterior hip is gluteus maximus. We will also see gluteus medius. And deep to gluteus maximus, we will have a cluster of muscles. This includes gluteus minimus, the piriformis, quadrilatus femoris, as well as the gemellus and obturator group. These muscles are all involved with rotation of the femur within the femoral acetabular junction. Additionally, we have the hamstring group. The hamstring group is made up of 3 distinct muscles: semitendinosus, deep to semitendinosus, we get to semimembranosus, both on the medial side of the posterior femoral region. And to the lateral side of the femoral region, we will see biceps femoris. Once again, this is why we have to be very careful with indicating of biceps as to which biceps we are talking about. Changing our angle of view, we have our adductor longus, our adductor magnus, just posterior and just deep to adductor longus. Lateral side, we have vastus lateralis. To the anterior vastus lateralis, you will see the rectus femoris. We have the tensor fascia lata, gluteus medius. Tensor fascia lata and gluteus medius is going to control pelvic tilt when we walk. I'll explain more about that when we're in lab looking at the cadaver. Gluteus maximus, biceps femoris. In this case here, the long head of the biceps femoris. The gastrocnemius. Gastrocnemius is going to have 2 heads to the gastrocnemius. There is a medial head and a lateral head. You can very clearly see the 2 heads on the lower extremity that is closest to us. Lateral to the gastrocnemius and anterior to the gastrocnemius, we will have the peroneal muscles. In this case here, peroneus longus, sometimes referred to as fibularis longus. Anterior to the longus muscle, we get the tertius muscle, peroneus tertius or fibularis tertius. And anterior to the tertius muscle, we will have the brevis muscle. These are the muscles that are going to control the amount of inversion and eversion that takes place along with the tibialis muscles. These are the muscles that tend to get damaged when you have an inversion ankle sprain. A little bit larger view of the posterior side of the lower extremities here. Starting from the most inferior and working superiorly, we start with the peroneus longus muscle on the lateral side. Then we get to the gastrocnemius, and once again, you can very clearly see the two heads to the gastrocnemius muscle. Then we get biceps femoris, semimembranosus, semitendinosus. Notice how semitendinosus has a much longer tendon than semimembranosus does. Then we get our visible gluteal muscles, gluteus medius and gluteus maximus. Deep to gluteus maximus, we will see gluteus minimus. To the medial side, we'll see adductor magnus, and just superior to adductor magnus is adductor longus. And just medial to adductor magnus, we will see the gracilis muscle.